Hello, future nurses. Welcome back to the channel that's dedicated to helping you conquer the NCLEX with confidence and clarity. Today's video is all about the pharmacology of cardiovascular disorders, one of the most high-yield and absolutely critical topics that you must understand to pass the NCLEX, and, more importantly, to provide safe and effective patient care. We're going to break down key medications like digoxin, beta blockers, ACE inhibitors, calcium channel blockers, and diuretics. You'll learn how these drugs work, why they're prescribed, what side effects to watch out for, and the nursing responsibilities you need to know on exam day and in real life. And here's the exciting part. Many of the questions we'll cover today have been asked on past NCLEX exams and are very likely to appear again. So this is not just a review. It's your shortcut to knowing exactly what the NCLEX loves to test. We're not just reading facts. We're walking through real NCLEX-style questions, just like the ones you'll face on your test, and I'll explain step by step how to think through them using clinical judgment. Before we dive in, here's something that could change your NCLEX journey. Are you ready to pass the NCLEX and kickstart your nursing career with confidence? Let me introduce you to the Complete NCLEX Review online course, the ultimate resource to help you succeed on your very first try. Inside, you'll find over 100 hours of animated lessons, 500 hours of recorded lectures, 5,000 high-yield NCLEX practice questions, and 500 Next Generation NCLEX case-based questions, covering everything from the basics to advanced clinical reasoning. You'll also benefit from 15 full-length CAT-style mock exams to sharpen your test day performance, plus a detailed NCLEX ebook you can access anytime. Best of all, you get a full year of access with just one simple payment. Thousands of students have already achieved success with this program. Now it's your turn. Head to the description, click the link, and enroll today. Your NCLEX success story starts here, so grab your notebook, stay locked in until the end, and let's make sure you are ready to crush this topic. Let's get started with our first question. A 78-year-old client with a history of congestive heart failure and atrial fibrillation is being monitored on digoxin therapy. The nurse reviews the client's laboratory results and notes a serum digoxin concentration of 2.5 nanograms per milliliter. The therapeutic reference range for digoxin is 0.5 to 2.0 nanograms per milliliter. The nurse also observes that the client has chronic kidney disease stage 3 and was recently prescribed furosemide for worsening peripheral edema. Which of the following actions should the nurse take as the priority? Let's carefully go through the answer options together. Option A, notify the primary healthcare provider immediately of the digoxin level and the client's current medication profile. Option B, review the electronic medical record for the client's last documented apical pulse and rhythm. Option C, document the result as slightly elevated and continue close monitoring of the client's clinical status. Option D, withhold the next scheduled dose of digoxin and reassess the medication administration plan in 4 hours. Now let's analyze what action takes precedence based on clinical judgment. The correct answer is Option A. Notify the primary healthcare provider immediately of the digoxin level and the client's current medication profile. This is essential because the elevated serum digoxin level, combined with chronic kidney disease and recent furosemide use, significantly increases the client's risk for digoxin toxicity. Prompt provider notification helps prevent severe complications, such as cardiac arrhythmias, by allowing for immediate intervention. Let's continue and take a look at Question 2, coming up next. A 70-year-old client recovering from an acute episode of digoxin toxicity is preparing for discharge. The client has a history of congestive heart failure, stage 3 chronic kidney disease, and hypertension. As part of discharge teaching, the nurse reinforces dietary strategies to help minimize the risk of future digoxin toxicity. Which dietary recommendation is most important for the nurse to emphasize based on the client's risk factors? Let's carefully go through the answer options together. Option A, maintain chloride intake to support acid-base homeostasis. Option B, ensure consistent dietary intake of potassium-rich foods such as bananas and sweet potatoes. Option C, increase phosphorus consumption to support skeletal and cardiac muscle contractility. Option D, liberalize sodium intake to promote fluid balance in heart failure. Now let's examine which option provides the most effective prevention strategy based on the clinical scenario. The correct answer is option B. Ensure consistent dietary intake of potassium-rich foods, such as bananas and sweet potatoes. Potassium is essential in maintaining normal cardiac rhythm and reducing myocardial sensitivity to digoxin. Hypokalemia increases the risk of digoxin-induced arrhythmias by intensifying its effect on the sodium-potassium adenosine triphosphatase pump. This becomes especially dangerous in older adults with chronic kidney disease who have decreased renal clearance and may be on potassium-wasting diuretics like furosemide. Emphasizing potassium intake from natural dietary sources like bananas, sweet potatoes, avocados, and leafy greens is a critical teaching point to help prevent future toxicity. Get ready as we now move ahead to explore the clinical reasoning in question 3. A 12-year-old client is admitted with a recent history of pharyngitis and now presents with fever, migratory polyarthritis, a new systolic murmur, and emotional lability. The healthcare provider suspects acute rheumatic fever. As the nurse prepares to implement the initial treatment plan, which of the following medications would the nurse most anticipate to be prescribed for management of the client's joint inflammation and pain? Let's carefully go through the answer options together. Option A, prazosin, an alpha-1 adrenergic blocker. Option B, naproxen, a non-steroidal anti-inflammatory drug. Option C, verapamil, a calcium channel blocker. Option D, furosemide, a loop diuretic. Now let's examine which of these medications would be most appropriate to address the client's symptoms. The correct answer is option B, naproxen, a non-steroidal anti-inflammatory drug. Naproxen is frequently used in pediatric clients with acute rheumatic fever to manage joint inflammation and pain due to its strong anti-inflammatory and analgesic properties. Migratory polyarthritis is one of the major clinical features of acute rheumatic fever and responds well to nonsteroidal anti-inflammatory drugs like naproxen or high-dose aspirin. Naproxen is often preferred because of its lower risk of gastrointestinal side effects and its longer duration of action, making it more suitable for children. Management of acute rheumatic fever is comprehensive and typically includes antibiotics to eliminate any remaining streptococcal infection, bed rest, and monitoring for cardiac involvement, with corticosteroids reserved for cases involving severe carditis. Stay with us. Now we'll cover another key NCLEX practice question to focus on. Are you ready to take your NCLEX prep to the next level? Join our complete NCLEX review online course. With over 100 hours of animated lectures, 500 hours of expert recorded content, 5,000 high-yield NCLEX questions, and 500 Next Generation NCLEX NGN practice questions. We cover everything from the basics to advanced clinical judgment. You'll also get 15 full-length CAT-style mock exams to boost your exam stamina, plus a comprehensive NCLEX ebook you can access anytime. Best of all, you get 1 year unlimited access with one easy payment. Before we dive in, let me quickly share this opportunity. Check the link in the description to enroll. Your NCLEX success story starts now. Let's dive into the next question and sharpen your test-taking skills. Let's keep going and check out the next important topic. Question 4. A 64-year-old client with a history of hypertension and chronic stable angina is receiving routine morning medications. The nurse reviews the clinical data, and here's what we've got. Blood pressure is 116 over 72 millimeters of mercury. Pulse is 54 beats per minute. Respirations are 16 breath per minute. Oxygen saturation is 98% on room air, and temperature is 36.9 degrees Celsius, or 98.4 degrees Fahrenheit. The current morning medication orders include atenolol 50 milligrams by mouth, so once daily, simvastatin 40 milligrams by mouth once daily, albuterol 2.5 milligrams via nebulizer daily, and spironolactone 25 milligrams by mouth once daily. Which medication orders should the nurse clarify with the primary healthcare provider before administration? Let's carefully go through the answer options together. Option A, atenolol. Option B, simvastatin. Option C, albuterol. Option D, spironolactone. Now let's analyze which medication may require reconsideration based on the clinical findings. The correct answer is option A, atenolol. Atenolol is a cardioselective beta-1 adrenergic blocker that slows heart rate and lowers blood pressure, which is useful in managing hypertension and angina. However, this client's pulse is 54 beats per minute, which is below the generally accepted threshold of 60 for safe beta blocker administration. In this case, the nurse should clarify the order with the primary healthcare provider before giving the dose, as continuing the medication may worsen bradycardia and put the client at risk for dizziness, syncope, or heart block. Vital signs must always be reviewed prior to giving medications that influence cardiac function. Simvastatin, albuterol, and spironolactone do not pose immediate concerns related to the current vital signs, making atenolol the clear priority for clarification. Don't go anywhere. The next question is another high-stakes scenario packed with clinical decision-making in question 5. A 62-year-old client who was prescribed atorvastatin 40 milligrams by mouth nightly 2 weeks ago for hyperlipidemia calls the nurse in a primary care clinic. The client reports the recent onset of bilateral leg pain, described as deep aching and muscle soreness, mainly in the thighs and calves, without any associated trauma or recent changes in physical activity. Which nursing action is most appropriate in this scenario? Let's carefully go through the answer options together. Option A, reassure the client that mild muscle pain is a common side effect and recommend continuing the medication as prescribed. Option B, advise the client to discontinue the medication and follow up in the clinic within the week for routine evaluation. Option C, recommend gentle stretching or the use of warm compresses to relieve muscle tension. Option D, instruct the client to immediately stop taking the medication and seek urgent evaluation at the nearest emergency department. Now let's analyze the safest and most clinically appropriate course of action. The correct answer is Option D, instruct the client to immediately stop taking the medication and seek urgent evaluation at the nearest emergency department. This client's description of new onset muscle pain after starting atorvastatin raises concern for statin-induced myopathy or rhabdomyolysis, a rare but potentially life-threatening condition involving skeletal muscle breakdown. Rhabdomyolysis can result in elevated creatine kinase levels, release of myoglobin into the bloodstream, acute kidney injury, and life-threatening electrolyte imbalances, such as hyperkalemia. Immediate discontinuation of the medication and emergency evaluation are necessary to prevent serious complications. Continuing the medication or delaying evaluation would be unsafe and may worsen muscle injury. Keep watching, because the next question brings another must-know scenario for NCLEX success. Coming up is question 6. A 53-year-old client is admitted to the medical unit with persistent fever, malaise, new onset exertional dyspnea, and a systolic murmur. Transesophageal echocardiography confirms vegetation on the mitral valve consistent with infective endocarditis. The nurse notes that blood cultures were drawn 30 minutes ago. Based on the client's current clinical status, which of the following medications should the nurse anticipate administering next? Let's carefully go through the answer options together. Option A, nitroglycerin, 0.4 milligrams sublingual for suspected cardiac ischemia. Option B, vancomycin, 1 gram intravenous every 12 hours. Option C, atorvastatin 40 milligrams by mouth for vascular protection. Option D, aspirin 325 milligrams by mouth for antiplatelet therapy. Now let's identify which of these interventions should be prioritized based on current evidence and clinical urgency. The correct answer is Option B, vancomycin 1 gram intravenous every 12 hours. And in the setting of confirmed infective endocarditis, once blood cultures have been drawn, empiric intravenous antibiotic therapy should be initiated promptly. Vancomycin is the standard initial therapy as it offers broad-spectrum coverage, particularly against gram-positive organisms such as methicillin-resistant Staphylococcus aureus, which is commonly implicated in endocarditis. Delaying antibiotics after cultures are obtained may increase the risk of systemic complications, including septic emboli or valve destruction. Stick with us. Question 7 is coming up next, and it's packed with more must-know clinical knowledge. The nurse is caring for a 68-year-old client with a history of atrial fibrillation and hypertension. The client reports palpitations, and the cardiac monitor reveals a heart rate of 136 beats per minute, with irregular R-wave to R-wave intervals. The healthcare provider writes a prescription for metoprolol 5 milliliters intravenous push 1 time. The nurse reviews the client's current medications and lab values, noting a serum potassium of 4.2 milliequivalents per liter and a blood pressure of 132 over 82 millimeters of mercury. What is the nurse's priority action? Let's carefully go through the answer options together. Option A. Contact the prescribing healthcare provider to verify and obtain a complete medication order prior to administration. Option B. Assess the client's heart rate and blood pressure at the bedside. Option C. Draw the medication into a 5 milliliter syringe using standard aseptic technique. Option D. Review the client's electronic medical record for beta blocker allergy documentation. Now let's determine which action takes priority based on medication safety and clinical standards. The correct answer is Option A. Contact the prescribing healthcare provider to verify and obtain a complete medication order prior to administration. The written prescription is incomplete and unsafe because it specifies only a volume of 5 milliliters, not the actual dosage in milligrams. Metoprolol comes in different concentrations, such as 1 milligram per milliliter, so giving a volume without knowing the exact dose can lead to serious complications like bradycardia or hypotension. The nurse's first responsibility is to clarify and confirm the exact dose, route, and frequency to prevent medication errors. Let's break down another potential NCLEX exam scenario that highlights client education. Want to pass the NCLEX on your first attempt? Our complete NCLEX review online course includes 100+ hours of animated video lessons, 500 hours of recorded sessions, 5,000 practice questions, and 500 NGN clinical judgment cases. You'll also receive 15 realistic CAT-style exams to build endurance and a downloadable NCLEX ebook to review anywhere, anytime. Plus, enjoy 12 months of full course access, all in one package. Before we jump in, I have exciting news that could change your exam journey. Find the link in the description and enroll today. Let's keep up the momentum and head into another high-yield question. Question 8. A nurse is conducting discharge teaching for a client newly prescribed bumetanide to manage volume overload associated with chronic systolic heart failure, also known as reduced ejection fraction. Which client statement indicates a correct understanding of the pharmacologic therapy and appropriate self-monitoring? Let's carefully go through the answer options together. Option A. I will increase my daily protein intake to prevent muscle loss while on this medication. Option B. I will keep track of how much urine I make every day to assess if the medicine is working. Option C. I will weigh myself every morning at the same time and report any weight gain over 2 to 3 pounds in 24 hours. Option D. I will check my blood pressure and pulse daily to make sure my heart rate stays low. Now let's determine which response reflects the most appropriate understanding of how to monitor the effects of bumetanide at home. The correct answer is Option C. I will weigh myself every morning at the same time and report any weight gain over 2 to 3 pounds in 24 hours. This demonstrates correct understanding because daily weight tracking is one of the most practical and sensitive methods for detecting early fluid retention in clients with heart failure. Bumetanide is a potent loop diuretic that promotes rapid diuresis, and sudden weight gain can be an early indicator of decompensated heart failure. Educating clients to weigh themselves each morning after voiding and under consistent conditions is essential for timely identification of worsening volume overload. Ready for more? Let's jump into another crucial nursing decision in question 9. A nurse is reviewing a newly initiated prescription for rivaroxaban 20 milligrams once daily for a client recently discharged after hospitalization for acute deep vein thrombosis. In evaluating the appropriateness and implications of this order, the nurse recognizes that the primary therapeutic use of rivaroxaban includes management of which clinical condition. Let's carefully go through the answer options together. Option A, pulmonary hypertension due to left heart dysfunction. Option B, venous thromboembolism, including deep vein thrombosis and pulmonary embolism. Option C, congestive heart failure with reduced ejection fraction. Option D, hyperlipidemia secondary to metabolic syndrome. Now let's determine which condition rivaroxaban is primarily indicated to treat. The correct answer is option B, venous thromboembolism, including deep vein thrombosis and pulmonary embolism. Rivaroxaban is a direct oral anticoagulant and works as a factor Xa inhibitor. It is specifically approved for the prevention and treatment of venous thromboembolism, which includes both deep vein thrombosis and pulmonary embolism. Its predictable dosing, reduced need for routine blood monitoring, and limited food-drug interactions make it a convenient and effective alternative to warfarin. The other conditions listed, including pulmonary hypertension, congestive heart failure, and hyperlipidemia, do not fall under rivaroxaban's approved therapeutic uses unless accompanied by thromboembolic risk factors. Don't go anywhere. Question 10 is coming up next with another essential pharmacology insight you'll want to remember. A pediatric nurse in a cardiac step-down unit is caring for a 6-month-old infant diagnosed with tetralogy of Fallot, who has experienced recurrent hypercyanotic episodes, also known as TET spells, over the past 24 hours. During multidisciplinary rounds, the team discusses pharmacologic interventions to stabilize the infant and reduce right ventricular outflow tract obstruction. Based on current evidence-based management guidelines, which medication should the nurse anticipate the provider to prescribe to directly address the pathophysiology of a hypercyanotic episode? Let's carefully go through the answer options together. Option A, morphine sulfate. Option B, adenosine. Option C, diltiazem. Option D, atropine sulfate. Now let's analyze which medication is the most appropriate and evidence-supported choice in this critical pediatric cardiac emergency. The correct answer is option A, morphine sulfate. Morphine is the drug of choice during a tetralogy of Fallot spell because it works on multiple levels to reverse the underlying pathophysiology. It sedates the infant, reducing oxygen demand and stress-induced catecholamine release, which can worsen right ventricular outflow tract spasm. Morphine also decreases the infundibular spasm that leads to obstruction, thereby improving pulmonary blood flow and systemic oxygenation. This intervention is used alongside other supportive measures, like knee-to-chest positioning and oxygen therapy. The other medications listed do not target the root cause of the cyanotic episode. Adenosine is used for supraventricular tachycardia. Diltiazem may reduce cardiac output in this fragile population, and atropine is reserved for bradycardia, not for the muscular obstruction and right-to-left shunting seen in tetralogy of Fallot spells. Get ready, question 11 is up next, and it's another deep dive into clinical judgment for high-acuity scenarios. A nurse is reviewing the admission medication reconciliation and corresponding laboratory test orders for 4 newly admitted clients. Which of the following laboratory test orders should the nurse question based on the prescribed pharmacologic agent? Let's carefully go through the answer options together. Option A, ordering liver function tests for a client initiated on atorvastatin therapy. Option B, ordering an international normalized ratio for a client initiated on rivaroxaban therapy. Option C, ordering a serum creatinine level for a client initiated on lisinopril therapy. Option D, ordering a hemoglobin, A1C level for a client initiated on olanzapine therapy. Now let's determine which of these laboratory orders does not align with the medication prescribed. The correct answer is option B, ordering an international normalized ratio for a client initiated on rivaroxaban therapy. Rivaroxaban is a direct oral anticoagulant and a factor Xa inhibitor that does not require routine coagulation monitoring, including international normalized ratio testing. This sets it apart from warfarin, which is titrated using international normalized ratio levels. While rivaroxaban may cause slight changes in prothrombin time or international normalized ratio values, these are not clinically useful for guiding therapy or predicting bleeding risk. Therefore, this order should be questioned. The other laboratory tests are appropriate. Liver function tests for atorvastatin, due to its risk for hepatotoxicity, serum creatinine for lisinopril, due to its effect on renal function, and hemoglobin A1C for olanzapine to monitor for drug-induced hyperglycemia. Keep going strong. Question 12 is just ahead, featuring another high-impact clinical reasoning scenario to sharpen your NCLEX skills. A nurse is reviewing medication orders for a client recently admitted with decompensated systolic heart failure, defined as a left ventricular ejection fraction less than 40%. The client's medical history includes hypertension and rheumatoid arthritis. Which newly prescribed medication should prompt the nurse to contact the primary healthcare provider for clarification? Let's carefully go through the answer options together. Option A, lisinopril. Option B, prednisone. Option C, hydralazine. Option D, carvedilol. Now let's analyze which of these medications poses the greatest concern in the context of this client's heart failure. The correct answer is option B, prednisone. Prednisone is a systemic corticosteroid that can worsen heart failure due to its mineralocorticoid effects, which lead to sodium and water retention. This increased fluid volume can raise preload and potentially exacerbate symptoms such as pulmonary congestion and peripheral edema in clients with reduced cardiac output. In heart failure management, maintaining fluid balance is crucial, and the addition of prednisone may destabilize this balance. Unless prednisone is being prescribed for a life-threatening inflammatory condition, its use should be carefully re-evaluated. The other medications are appropriate. Lisinopril, a first-line angiotensin-converting enzyme inhibitor, reduces cardiac workload and improves survival. Hydralazine is useful as a vasodilator, especially in combination with nitrates for African American clients. And carvedilol, a beta blocker with alpha-blocking properties, is part of standard therapy to control heart rate, improve ejection fraction, and reduce mortality. Keep your focus sharp. Question 13 is on the way with more complex, real-world NCLEX decision-making. The nurse is managing the care of a client who is receiving both a continuous infusion of heparin and warfarin therapy for the prevention of venous thromboembolism. The nurse reviews the client's latest laboratory results. She reviews the client's most recent lab results, and here's what comes up. Activated partial thromboplastin time is 100 seconds, with a normal range of 30 to 40 seconds, and international normalized ratio is 2.5, which falls within the therapeutic range of 2.0 to 3.0 for venous thromboembolism treatment. Given these values, the nurse understands that which action is the most appropriate to ensure patient safety. Let's carefully go through the answer options together. Option A, document the findings and continue monitoring the patient's lab results. Option B, discontinue the heparin infusion immediately and recheck the activated partial thromboplastin time after 30 minutes. Option C, hold future doses of warfarin, as the international normalized ratio is at risk of becoming excessively high. Option D, administer a dose of vitamin K to correct the patient's anticoagulation levels. Now let's assess which option most directly addresses the critical safety concern in this situation. The correct answer is option B. Discontinue the heparin infusion immediately and recheck the activated partial thromboplastin time after 30 minutes. The value of 100 seconds is significantly prolonged, indicating excessive anticoagulation from the heparin infusion. Since heparin's effects are short-acting, stopping the infusion allows the activated partial thromboplastin time to return toward a safer range, reducing the risk of spontaneous bleeding. Monitoring alone is not sufficient, as action must be taken to reduce the anticoagulant effect. The warfarin therapy, reflected by an international normalized ratio of 2.5, is within therapeutic range, so holding doses or giving vitamin K is unnecessary and inappropriate in this case. Let's move forward. Question 14 will challenge your critical thinking with another high-risk medication scenario. A client diagnosed with atrial fibrillation and chronic heart failure is receiving a regimen that includes digoxin 0.12, 5 milligrams by mouth, daily, and furosemide 40 milligrams by mouth daily. During a routine assessment, the nurse checks the client and here's what comes up. Blood pressure is 122 over 76 millimeters of mercury. Heart rate is 64 beats per minute and regular, and the client reports occasional vomiting along with seeing colored halos around lights. Electrolyte values are still pending. So, which clinical findings should the nurse recognize as requiring immediate follow-up with the healthcare provider? Let's carefully go through the answer options together. Option A, reports of night sweats and intermittent headache. Option B, reports of vomiting and visual disturbances described as halos around lights. Option C, reports of generalized fatigue and dry, flaky skin. Option D, blood pressure slightly below baseline and dark-colored urine in the morning. Now let's determine which of these clinical symptoms requires urgent attention based on the client's medications and diagnosis. The correct answer is option B, reports of vomiting and visual disturbances described as halos around lights. These are classic warning signs of digoxin toxicity, which can quickly become life-threatening, especially in clients who are also taking furosemide. Furosemide A can cause hypokalemia, and low potassium levels increase the heart's sensitivity to digoxin, raising the risk of dangerous arrhythmias. This situation calls for immediate action, holding the next dose of digoxin, checking potassium and serum digoxin levels, and preparing for potential treatment with digoxin-specific antibody fragments if toxicity is confirmed. The other symptoms listed are either vague or less urgent, and do not indicate an immediate pharmacologic emergency. Let's keep going. Question 15 is coming up next, and it dives into another high-risk clinical scenario you'll want to master. A client newly diagnosed with stage 2 hypertension is prescribed hydralazine 25 milligrams by mouth 3 times daily. On day 3 of therapy, the nurse checks the client's vital signs, and here's what we've got. Blood pressure is 120 over 70 millimeters of mercury. Heart rate is 67 beats per minute. Total cholesterol is 185 milligrams per deciliter, and activated partial thromboplastin time is 45 seconds. Based on the current assessment findings, which value most accurately indicates that the client is experiencing a therapeutic response to the prescribed medication? Let's carefully go through the answer options together. Option A, blood pressure, 120 over 70 millimeters of mercury. Option B, pulse 67 beats per minute. Option C, total cholesterol 185 milligrams per deciliter. Option D, activated partial thromboplastin time 45 seconds. Now let's evaluate which of these findings directly reflects the intended therapeutic effect of hydralazine. The correct answer is option A, blood pressure 120 over 70 millimeters of mercury. Hydralazine is a direct-acting vasodilator that targets arterioles and is used to reduce elevated blood pressure in moderate to severe hypertension. The goal of therapy is to lower systemic vascular resistance and bring blood pressure within a safe, controlled range. In this case, the reduction to a blood pressure of 120 over 70 shows that the medication is working effectively. The other values do not reflect hydralazine's mechanism of action. The heart rate is within normal limits, but does not indicate the drug's primary effect. Total cholesterol is unrelated to this antihypertensive agent. An activated partial thromboplastin time is used to monitor anticoagulation, not relevant here. Let's keep building your clinical confidence. Question 16 is coming up next with another high-yield scenario for NCLEX mastery. A 56-year-old client newly diagnosed with stage 1 hypertension has been prescribed amlodipine 5 milligrams by mouth daily and advised to implement lifestyle modifications, including weight loss and sodium restriction. During a follow-up appointment, the nurse evaluates the client's understanding of the treatment regimen. Which client statement requires the nurse to intervene and provide further education? Let's carefully go through the answer options together. Option A, I signed up for fitness training and nutrition counseling to help manage my blood pressure. Option B, I heard it's good to have grapefruit juice with my amlodipine. Option C, how do I make sure my eating habits and workouts align with my prescribed therapy? Option D, at times I feel lightheaded following my dose of amlodipine. Now let's identify which of these responses signals a need for immediate nursing intervention. The correct answer is Option B. I heard it's good to have grapefruit juice with my amlodipine. This statement reflects a dangerous misconception, as grapefruit juice inhibits the enzyme CYP3, A4 responsible for metabolizing amlodipine. This can lead to elevated blood levels of the drug and increase the risk of side effects like hypotension, dizziness, and peripheral edema. While this interaction is strongest with certain other calcium channel blockers, it is still clinically significant with amlodipine. The client needs prompt education on avoiding grapefruit juice while taking this medication. The other statements demonstrate proactive engagement or mild expected side effects and do not indicate a knowledge deficit requiring urgent correction. Stay tuned. Question 17 is coming up, and it's another real-world nursing challenge you'll want to get right. A 68-year-old male client is admitted to the cardiac care unit with acute substernal chest pain radiating to the left arm, shortness of breath, diaphoresis, nausea, and a sense of impending doom. The electrocardiogram reveals ST segment elevation in leads 2, 3, and AVF, and the troponin I level is significantly elevated. The nurse identifies that the client is experiencing an acute inferior wall myocardial infarction. In reviewing the plan of care, which of the following medications should the nurse prioritize, requesting a prescription for, to optimize myocardial perfusion and reduce mortality? Let's carefully go through the answer options together. Option A, metoprolol. Option B, amiodarone. Option C, enalapril. Option D, diltiazem. Now let's analyze which intervention is most appropriate in the acute phase of a myocardial infarction. The correct answer is option A, metoprolol. Metoprolol is a beta-1 selective adrenergic blocker that plays a critical role in early myocardial infarction management. When administered within the first 24 hours, it decreases heart rate, blood pressure, and myocardial contractility, effectively reducing oxygen demand on the heart. More importantly, it also lowers the risk of dangerous ventricular arrhythmias and helps limit infarct size, which contributes to improved survival outcomes. Unless contraindicated by bradycardia, hypotension, or cardiogenic shock, early beta blockade is considered standard of care. The other medications listed serve important roles in specific scenarios but are not priorities during acute stabilization. Amiodarone is used for life-threatening arrhythmias, enalapril is beneficial in long-term heart failure management, and diltiazem may depress cardiac function, making it unsuitable in this context. Keep your momentum going. Question 18 is coming up next with another life-saving decision point to test your clinical judgment. A 62-year-old client recently diagnosed with primary, or essential, hypertension has been prescribed a calcium channel blocker, specifically amlodipine, as part of their long-term blood pressure management plan. During a follow-up outpatient visit, the client reports adherence to the prescribed medication, dietary modifications, and an increased intake of fresh fruit juices as part of their healthy lifestyle changes. Which of the following statements by the client indicates a need for further education and requires immediate nursing intervention? Let's carefully go through the answer options together. Option A, I've started including boiled eggs for protein in my breakfast. Option B, I drink 2 glasses of milk daily to strengthen my bones. Option C, I've replaced soda with fresh grapefruit juice every morning. Option D, I eat a banana each day to maintain my potassium level. Now let's determine which statement poses a direct risk to the client's safety and medication effectiveness. The correct answer is option C. I've replaced soda with fresh grapefruit juice every morning. Grapefruit juice is known to inhibit the CYP3A4 enzyme in the small intestine, which plays a key role in metabolizing drugs like amlodipine. When grapefruit juice is consumed, it can significantly increase the concentration of amlodipine in the bloodstream, raising the risk for serious side effects such as severe hypotension, bradycardia, and peripheral edema. This interaction is clinically significant and requires the nurse to intervene immediately and educate the client to avoid grapefruit products entirely while on calcium channel blockers. The other dietary habits mentioned, eating eggs, drinking milk, and consuming bananas, do not interfere with the metabolism or safety of amlodipine and are consistent with general health recommendations. Up next, we'll dive into another essential case for your clinical toolkit. Question 19 is just ahead. A 58-year-old client with mixed dyslipidemia is being discharged after receiving counseling on initiating prescription-strength niacin, also known as nicotinic acid. The nurse is reviewing the client's understanding of the medication's common effects and necessary precautions. Which of the following client statements best demonstrates appropriate understanding of this therapy? Let's carefully go through the answer options together. Option A, I should monitor my blood pressure closely because this medicine might increase it. Option B, I've been told I might feel a warm, flushing sensation after taking the pills. Option C, my doctor said this medication might raise my total cholesterol levels for a while. Option D, I should expect to feel more tired than usual after taking niacin. Now let's determine which statement reflects accurate knowledge of niacin therapy. The correct answer is option B. I've been told I might feel a warm, flushing sensation after taking the pills. This is a well-known and common side effect of niacin caused by prostaglandin-mediated vasodilation, particularly in the face and upper chest. Clients often describe it as a warm, red, or tingling sensation, which, although uncomfortable, is usually harmless and temporary. Educating clients ahead of time helps improve medication adherence. Taking low-dose aspirin 30 minutes before niacin or using an extended-release formulation can reduce this effect. The other options reflect misunderstandings. Niacin does not raise blood pressure or total cholesterol, and it does not typically cause fatigue. If anything, clients may feel slightly restless or energized. Let's keep the momentum going. Question 20 is coming up, and it's another high-yield clinical moment you won't want to miss. A 74-year-old client with a history of chronic heart failure is admitted with new-onset confusion, nausea, and visual disturbances described as yellow-green halos. The client's heart rate is bradycardic at 52 beats per minute. Laboratory results reveal a serum digoxin level of 2.8 nanograms per milliliter and a potassium level of 3.0 milliequivalents per liter. The healthcare provider suspects digitalis toxicity. Which medication should the nurse anticipate being prescribed as the immediate pharmacological intervention? Let's carefully go through the answer options together. Option A, digoxin immune fab. Option B, milrinone. Option C, amrinone. Option D, flecainide. Now let's determine which of these interventions directly addresses the root cause of the client's symptoms. The correct answer is Option A, digoxin immune fab. This client is demonstrating classic signs of digoxin toxicity, including bradycardia, altered vision, confusion, and gastrointestinal symptoms. The digoxin level is significantly above the therapeutic range, and the presence of hypokalemia further increases the risk of dangerous cardiac arrhythmias. Digoxin immune fab is an antibody fragment derived from sheep that binds to digoxin in the bloodstream, rendering it inactive. It is considered the first-line antidote in cases of moderate to severe digoxin toxicity and works rapidly to reduce clinical symptoms and prevent lethal arrhythmias. The other options are inappropriate. Milrinone and amrinone are inotropic agents used in heart failure, but do not counteract digoxin toxicity. And flecainide is an antiarrhythmic that could actually worsen outcomes in digoxin-toxic patients. Let's continue with another crucial NCLEX-style question focused on medication safety. If you're overwhelmed by NCLEX prep, this course is your solution. The complete NCLEX Review online course provides animated explainer videos, 500-plus hours of expert recordings, 5,000 practice NCLEX questions, and NGN case-based exercises. You also get 15 adaptive CAT exams to simulate the real test and a comprehensive NCLEX ebook to support your learning. With 12 months of access, you'll have all the time you need to master the material. Just before we get into the questions, here's something that can take your prep to the next level. Check the description for the link and enroll now. Let's get into the next question and start building your confidence. Question 21. The nurse is performing a final verification of medication orders for 4 clients during morning rounds. Which of the following newly prescribed medications should prompt the nurse to immediately contact the healthcare provider for clarification? Let's carefully go through the answer options together. Option A, captopril for a client with New York Heart Association, Class 3 congestive heart failure, and a serum potassium of 4.5 milliequivalents per liter. Option B, metoprolol tartrate for a client experiencing frequent symptomatic premature ventricular contractions with a heart rate of 72 beats per minute. Option C, verapamil for a client diagnosed with persistent atrial fibrillation and a resting ventricular response rate of 110 beats per minute. Option D, spironolactone for a client undergoing maintenance hemodialysis for end-stage renal disease with a baseline serum potassium of 5.8 milliequivalents per liter. Now let's determine which order presents the greatest risk and warrants immediate clarification. The correct answer is Option D, spironolactone for a client undergoing maintenance hemodialysis for end-stage renal disease with a baseline serum potassium of 5.8 milliequivalents per liter. Spironolactone is a potassium-sparing diuretic that can significantly raise serum potassium levels. In a client with end-stage renal disease who already has impaired potassium excretion and an elevated baseline potassium level, this medication poses a high risk of life-threatening hyperkalemia. This situation requires urgent provider notification to prevent potential cardiac complications. The other orders are appropriate within the context provided. Captopril is a standard therapy in heart failure with a normal potassium level. Metoprolol is useful for managing symptomatic premature ventricular contractions, and verapamil is suitable for controlling the ventricular rate in atrial fibrillation when the heart rate is elevated. Stay focused. Question 22 is on the way, and it's another critical test of safe medication administration. The nurse is preparing to administer the following scheduled medications to a 70-year-old client diagnosed with chronic hypertension and a history of atrial fibrillation. Morning vital signs reveal a blood pressure of 122 over 78 millimeters of mercury, a heart rate of 48 beats per minute, a respiratory rate of 18 breaths per minute, a temperature of 98.6 degrees Fahrenheit or 37 degrees Celsius, and an oxygen saturation of 98% on room air. Which of the following prescribed medications should the nurse withhold and notify the healthcare provider before administering? Let's carefully go through the answer options together. Option A, amlodipine 5 mg by mouth. Option B, diltiazem 60 mg by mouth. Option C, ibuprofen 500 mg by mouth. Option D, ciprofloxacin 500 mg by mouth. Now let's identify which of these medications poses a potential risk in the context of this client's vital signs. The correct answer is option B, diltiazem 60 mg by mouth. Diltiazem is a non-dihydropyridine calcium channel blocker that slows conduction through the sinoatrial and atrioventricular nodes, making it effective for rate control in atrial fibrillation. However, with a resting heart rate of 48 beats per minute, administering diltiazem could worsen bradycardia and potentially lead to heart block or even asystole. The nurse must withhold the medication and notify the healthcare provider for reassessment. The other medications do not have direct effects on heart rate. Amlodipine acts primarily on blood vessels and is safe in bradycardia unless hypotension is present. Ibuprofen and ciprofloxacin do not suppress cardiac conduction and are not immediately contraindicated in this scenario. Let's keep moving. Question 23 is up next, with more clinical pearls to strengthen your NCLEX decision-making. A nurse is reviewing the medication profile of a 64-year-old male client who has been prescribed sildenafil for treatment of erectile dysfunction. The client's active medication list includes the following: isosorbide mononitrate 30 mg by mouth daily, furosemide 40 mg by mouth twice a day, atorvastatin 20 mg by mouth at bedtime, and losartan 50 mg by mouth daily. Which of the client's current medications should prompt the nurse to immediately notify the healthcare provider and withhold the sildenafil? Let's carefully go through the answer options together. Option A, furosemide. Option B, isosorbide. Option C, atorvastatin. Option D, losartan. Now let's determine which of these medications presents a dangerous interaction when combined with sildenafil. The correct answer is option B, isosorbide. Isosorbide mononitrate is a long-acting nitrate commonly used to prevent angina by causing vasodilation. Sildenafil, a phosphodiesterase type 5 inhibitor, also promotes vasodilation through the nitric oxide pathway. When taken together, these medications can cause a profound drop in blood pressure, leading to life-threatening hypotension, syncope, or even myocardial infarction. This combination is an absolute contraindication and must be avoided. The nurse should immediately notify the healthcare provider and withhold the sildenafil. The other medications, furosemide, atorvastatin, and losartan, do not present this same level of risk and are not absolutely contraindicated with sildenafil, though some may require monitoring. Let's move forward with confidence. Question 24 is up next, and it highlights another vital concept in pharmacologic safety. A nurse is evaluating the therapeutic efficacy of chylostazol in a 67-year-old client recently diagnosed with peripheral arterial disease. The client reports a reduction in the intensity and frequency of claudication symptoms over the past 2 weeks. Based on this clinical assessment, which of the following findings most accurately reflects a positive therapeutic response to the medication? Let's carefully go through the answer options together. Option A, the client reports no leg pain while walking previously limiting distances. Option B, the client's total serum cholesterol has decreased by 40 milligrams per deciliter. Option C, the client reports clearer vision when reading small print. Option D, the client's mini mental state examination score improved by 3 points. Now let's determine which of these responses is the most appropriate indicator of cholestazol's effectiveness. The correct answer is Option A. The client reports no leg pain while walking previously limiting distances. Cholestazol is a phosphodiesterase type 3 inhibitor that improves walking distance and reduces claudication pain by promoting vasodilation and improving blood flow to ischemic limb tissues. A reduction in leg pain during activity directly demonstrates the drug's therapeutic benefit. The other options are unrelated to the mechanism or intended outcome of cholestazol. Cholesterol changes are better addressed with statins. Visual changes are unrelated to cholestazol therapy, and cognitive improvements do not reflect the drug's clinical purpose. Stay sharp? Question 25 is just ahead, with another opportunity to reinforce pharmacologic judgment on the NCLEX. The pediatric nurse is preparing to administer a scheduled dose of digoxin to a 5-month-old infant admitted for management of congestive heart failure secondary to a congenital ventricular septal defect. Before administering the medication, the nurse reviews the infant's most recent cardiac assessment and prepares to auscultate the apical heart rate using a pediatric stethoscope placed at the point of maximal impulse. Which of the following apical pulse rates, if auscultated over a full 60 seconds, would indicate it is safe to proceed with administration of the prescribed digoxin dose? Let's carefully go through the answer options together. Option A, 70 beats per minute. Option B, 60 beats per minute. Option C, 90 beats per minute. Option D, 50 beats per minute. Now let's determine which apical pulse rate meets the safety threshold for administering digoxin in an infant. The correct answer is Option C, 90 beats per minute. In infants less than 1 year old, a minimum apical pulse of 90 beats per minute is required before giving digoxin. This is because digoxin slows the heart rate, and infants are particularly vulnerable to bradycardia, one of the earliest signs of digoxin toxicity. Administering the medication when the heart rate is below the threshold could precipitate dangerous complications. The other pulse values, 70, 60, and 50, are too low and signal a need to hold the dose and immediately notify the healthcare provider. Let's keep going. Question 26 is next, and it highlights another high-stakes pediatric safety consideration. A nurse is reviewing a newly prescribed medication order for apixaban for a 68-year-old client with a recent history of prolonged immobilization following orthopedic surgery. Based on this clinical context, the nurse identifies that the primary therapeutic indication for this prescription is management of which of the following conditions. Let's carefully go through the answer options together. Option A, pulmonary hypertension. Option B, venous thromboembolism. Option C, congestive heart failure. Option D, hypertension. Now let's determine which condition apixaban is most appropriately used to treat in this clinical setting. The correct answer is Option B, venous thromboembolism. Apixaban is a direct oral anticoagulant that selectively inhibits activated factor 10A in the coagulation cascade. It is widely used for the treatment and prevention of venous thromboembolism, including deep vein thrombosis and pulmonary embolism, especially in clients at high risk due to surgery or immobility. Unlike warfarin, apixaban offers the benefit of not requiring routine international normalized ratio monitoring and has fewer dietary restrictions. The other options are incorrect. Apixaban does not treat pulmonary hypertension, congestive heart failure, or systemic hypertension, as it has no effect on vascular resistance or cardiac function. Now we'll cover another key NCLEX practice question, focused on medication safety education. Stop jumping between resources. The complete NCLEX review. Online course packs in 100+ hours of animation-based teaching, 500 hours of instructor-led content, 5,000 NCLEX-style questions, and hundreds of NGN practice challenges. Plus, you'll tackle 15 realistic CAT-style exams and get a handy NCLEX ebook to study from anywhere. You'll enjoy 1 full year of unlimited access, so you can learn at your own pace. Quick announcement before we start. I've got a resource that will change your NCLEX prep. Check the description and sign up today. Without further delay, let's tackle today's must-know question. Question 27. A nurse is providing discharge education to a client newly prescribed enalapril for management of stage 2 hypertension and diabetic nephropathy. During the teaching session, the nurse prioritizes which of the following instructions, due to its potential for rapid onset, life-threatening adverse effects associated with this drug class. Let's carefully go through the answer options together. Option A. You may develop a dry, persistent cough while taking this medication. Option B. If you experience swelling of your lips, face, or eyes, notify your provider immediately. Option C. This medication may alter your ability to taste certain foods. Option D. You'll require regular blood tests to monitor your kidney function and electrolyte levels. Now let's determine which instruction addresses the most serious and time-sensitive risk associated with enalapril. The correct answer is option B. If you experience swelling of your lips, face, or eyes, notify your provider immediately. Enalapril is an angiotensin-converting enzyme inhibitor, and although generally well-tolerated, it can cause angioedema, a rare but life-threatening reaction involving rapid swelling of the airway and facial structures. Because angioedema can progress quickly and lead to airway obstruction, educating the client to recognize and report these symptoms immediately is essential. While other options mention important side effects, such as dry cough, altered taste, and the need for lab monitoring, they do not present an immediate threat to life. Let's continue building your clinical judgment. Question 28 is coming up next with another vital, safety-focused scenario. A nurse is educating a client recently diagnosed with chronic congestive heart failure who has been prescribed torsemide. To assess the client's understanding of this loop diuretic therapy, which client statement best demonstrates accurate knowledge of self-management strategies that promote early detection of fluid volume changes? Let's carefully go through the answer options together. Option A. I will start reducing how much potassium I eat each day. Option B. I'll keep a record of how much I urinate throughout the day. Option C. I will weigh myself every morning after I use the bathroom. Option D. I plan to check my blood pressure and pulse at home every day. Now let's identify which of these self-care practices is most effective in detecting changes in fluid status while on torsemide. The correct answer is option C. I will weigh myself every morning after I use the bathroom. This demonstrates the most accurate understanding of torsemide's therapeutic effect and the best method for identifying early signs of fluid retention or excessive fluid loss. Daily weights, taken at the same time each morning on the same scale, and after voiding, provide the most reliable measure of volume status in heart failure clients. Sudden changes in weight, such as a gain of more than 2 pounds in 24 hours, can indicate worsening heart failure or inadequate diuretic effect. The other statements reflect misunderstandings. Reducing potassium is inappropriate with potassium-wasting diuretics like torsemide. Tracking urine output is less practical in outpatient settings, and while blood pressure monitoring can be helpful, it's not the most sensitive indicator of volume changes. Keep up the focus. Question 29 is coming next, and it's another essential moment for clinical safety and client teaching. A nurse educator is leading a professional development workshop for cardiovascular nurses on the pharmacologic management of common cardiac conditions. During a discussion on calcium channel blockers, the nurse emphasizes the importance of recognizing contraindications. Which of the following clinical scenarios would contraindicate the use of a calcium channel blocker due to its direct impact on myocardial contractility? Let's carefully go through the answer options together. Option A. Atrial fibrillation with rapid ventricular response. Option B. Chronic stage 1 or stage 2 hypertension. Option C. Peripheral vascular disease with intermittent claudication. Option D. Systolic heart failure with reduced ejection fraction. Now let's determine which of these clinical scenarios would make calcium channel blocker use inappropriate. The correct answer is option D. Systolic heart failure with reduced ejection fraction. Non-dihydropyridine calcium channel blockers like verapamil and diltiazem have negative inotropic effects, meaning they reduce the strength of heart muscle contraction. In clients with systolic heart failure, where the heart's pumping ability is already compromised, this action can further reduce cardiac output and precipitate worsening heart failure. For this reason, calcium channel blockers are contraindicated in heart failure with reduced ejection fraction. The other scenarios do not represent contraindications. Calcium channel blockers are frequently used to manage atrial fibrillation with rapid rates, hypertension, and peripheral vascular disease. Let's continue building clinical insight. Question 30 is coming up next, rounding out this critical set of cardiovascular pharmacology pearls. A nurse is providing discharge education to a client recently prescribed hydrochlorothiazide for management of stage 1 hypertension. Which of the following client statements best reflects an accurate understanding of a clinically relevant adverse effect associated with this medication? Let's carefully go through the answer options together. Option A. I should limit extended periods of sun exposure because hydrochlorothiazide can make my skin more sensitive to sunlight. Option B. I might feel unusually sleepy or sedated since hydrochlorothiazide can slow down the activity of my central nervous system. Option C. Because this medication lowers my calcium levels, I'll increase foods rich in calcium like dairy products. Option D. There's a chance I could lose my sense of taste or develop a poor appetite while taking this medication. Now let's identify which statement most accurately reflects a known side effect of hydrochlorothiazide therapy. The correct answer is Option A. I should limit extended periods of sun exposure because hydrochlorothiazide can make my skin more sensitive to sunlight. Hydrochlorothiazide is associated with photosensitivity reactions, which may increase the client's risk of sunburn and skin irritation following ultraviolet radiation exposure. It is important for clients to protect their skin with sunscreen, wear protective clothing, and avoid peak sun hours. The other statements are inaccurate. Hydrochlorothiazide does not cause central nervous system depression or sedation. It may actually raise, not lower, calcium levels, and it is not commonly linked to altered taste or appetite suppression. Let's keep going. Question 31 is coming next, focusing on another essential client safety consideration in antihypertensive therapy. An emergency department nurse is managing a hemodynamically stable client diagnosed with an enlarging abdominal aortic aneurysm who now presents with increasing abdominal and back pain, suggestive of impending rupture. The nurse anticipates the primary healthcare provider will most likely prescribe which of the following medications as a pharmacologic priority to mitigate further vascular compromise? Let's carefully go through the answer options together. Option A, esmolol. Option B, dexamethasone. Option C, heparin. Option D, pantoprazole. Now let's determine which of these interventions is most appropriate in the setting of a suspected abdominal aortic aneurysm on the verge of rupture. The correct answer is Option A, esmolol. Esmolol is a short-acting cardioselective beta-1 blocker that is commonly used to rapidly lower systolic blood pressure and heart rate in acute aortic syndromes. By reducing myocardial contractility and arterial wall stress, esmolol helps prevent aneurysm rupture while the client is stabilized for surgical repair. It is ideal in emergent situations because of its quick onset and short half-life, allowing for precise titration. The other options are not appropriate in this scenario. Dexamethasone is used for inflammation, not vascular control. Heparin is contraindicated due to the high risk of bleeding with suspected aneurysm rupture, and pantoprazole has no effect on vascular stability and is used for gastrointestinal acid suppression. Let's keep going. Question 32 is coming up, taking us deeper into high-stakes emergency pharmacology. A nurse has provided comprehensive medication education to a client newly prescribed enalapril for the management of hypertension and heart failure. Which of the following statements made by the client indicates accurate understanding and appropriate comprehension of the potential adverse effects and management of this medication? Let's carefully go through the answer options together. Option A. I will notify my prescriber immediately if I develop facial swelling or difficulty breathing. Option B. It is important that I weigh myself every morning while taking this medication to monitor for any fluid retention. Option C. I should increase my intake of potassium-rich foods to prevent potential electrolyte imbalances associated with this medication. Option D. Periodic laboratory tests will be necessary to monitor my liver function, as enalapril can have hepatotoxic effects. Now let's identify which statement best reflects accurate knowledge of this medication's risks. The correct answer is Option A. I will notify my prescriber immediately if I develop facial swelling or difficulty breathing. This shows the client understands the risk of angioedema, a rare but life-threatening adverse effect of enalapril and other angiotensin-converting enzyme inhibitors. Angioedema can cause rapid swelling of the lips, face, and airway, and requires immediate medical attention to prevent respiratory compromise. The other responses are incorrect. Option B refers to weight monitoring, which is essential for clients on diuretics, not angiotensin-converting enzyme inhibitors, like enalapril. Option C is unsafe, as enalapril can increase potassium levels, so clients should avoid excess potassium unless advised otherwise. Option D is inaccurate, because enalapril affects renal, not liver, function. So monitoring kidney function and electrolytes is the clinical priority, not liver enzymes. Stay sharp. Question 33 is coming up next, with another crucial pharmacologic safety scenario to reinforce high-level National Council licensure examination decision-making. The emergency department nurse is managing a client who presents with a hypertensive crisis, characterized by critically elevated blood pressure and signs of acute target organ damage. After a thorough assessment, the nurse anticipates the healthcare provider will prescribe a medication to lower the client's blood pressure acutely. Which of the following intravenous medications is most appropriate for the management of this hypertensive emergency? Let's carefully go through the answer options together. Option A, dobutamine. Option B, digoxin. Option C, nicardipine. Option D, amiodarone. Now let's determine which medication directly addresses the acute reduction of blood pressure in a hypertensive emergency. The correct answer is option C, nicardipine. Nicardipine is a calcium channel blocker administered intravenously to rapidly and precisely reduce blood pressure in clients experiencing a hypertensive emergency. It relaxes vascular smooth muscle, promoting vasodilation and controlled lowering of blood pressure. It is given as a continuous infusion and titrated based on therapeutic response, with close blood pressure monitoring to avoid complications from rapid reductions. The other options do not address the underlying issue. Option A, dobutamine, is an inotrope used to improve cardiac output in heart failure, not to lower blood pressure. Option B, digoxin, is used for atrial fibrillation and heart failure, but does not produce vasodilation or treat hypertension. And option D, amiodarone, is an antiarrhythmic and has no role in lowering blood pressure during hypertensive crises. Stay alert. Question 34 is coming next with another high-acuity medication scenario to test your clinical readiness. A nurse is conducting discharge education for a client recently prescribed furosemide as part of a comprehensive treatment plan for hypertension. Which of the following client statements demonstrates appropriate understanding of safe and effective medication administration? Let's carefully go through the answer options together. Option A, I need to cut down on eating bananas, cantaloupe, and potatoes while I'm on this medication. Option B, I'll make sure to avoid drinking grapefruit juice with this drug to prevent any interactions. Option C, I should take this medication in the morning to avoid having to get up during the night to urinate. Option D, if I develop a persistent cough, I'll notify my provider immediately since it's a common side effect of this medication. Now let's determine which response reflects the correct and safe use of furosemide. The correct answer is option C. I should take this medication in the morning to avoid having to get up during the night to urinate. Furosemide is a loop diuretic that increases urinary output significantly. Taking it in the morning helps prevent nocturia and sleep disruption. Clients prescribed a second dose are usually instructed to take it no later than mid-afternoon. The other statements are incorrect. Option A is misleading because furosemide causes potassium loss, so potassium-rich foods like bananas and potatoes are actually encouraged. Option B is not applicable, as grapefruit juice does not interact with furosemide. Option D describes a side effect more commonly associated with angiotensin-converting enzyme inhibitors, not furosemide. Now we'll cover another key NCLEX practice question focused on heart failure management and medication response. Thousands of students have passed with our system, and now it's your turn. The complete NCLEX review. Online course includes over 100 hours of visual learning, 500 hours of detailed lectures, 5,000 NCLEX review questions, and NGN case studies. You'll also practice with 15 full-length CAT mock tests and use a detailed NCLEX ebook anytime you need a refresher. Best part? You get 1 year of complete access to every resource. Before we continue, here's an incredible opportunity you can't miss. Find the enrollment link in the description and join us today. Let's roll into today's question and see how you do. Let's continue and tackle the next valuable medication teaching question. Question 35. The nurse is evaluating a client diagnosed with systolic heart failure who is currently receiving carvedilol therapy. Which of the following assessment findings would most clearly indicate that the client is demonstrating a favorable clinical response to this pharmacologic intervention? Let's carefully go through the answer options together. Option A, greater urine output. Option B, improved left ventricular ejection fraction. Option C, worsening structural changes in the left ventricle. Option D, elevated levels of brain natriuretic peptide. Now let's determine which of these findings most accurately reflects a positive therapeutic outcome of carvedilol. The correct answer is option B, improved left ventricular ejection fraction. Carvedilol is a non-selective beta-adrenergic blocker with alpha-1 blocking activity that reduces myocardial oxygen demand, heart rate, and afterload. In systolic heart failure, an improvement in left ventricular ejection fraction signals enhanced cardiac output and ventricular function, which is a direct marker of the effectiveness of beta blocker therapy. The other options are incorrect. Option A, greater urine output, is not a primary effect of carvedilol and is more closely linked to diuretic use. Option C, worsening structural changes in the left ventricle, would indicate disease progression, not improvement. And option D, elevated brain natriuretic peptide, is associated with worsening heart failure and increased ventricular stress. Let's continue. Question 36 is up next, offering another critical clinical application in cardiovascular pharmacology. A nurse is conducting discharge education for a client recently diagnosed with hypertension who has been initiated on diltiazem therapy. In reinforcing medication safety and pharmacologic precautions, which of the following client statements would indicate that additional teaching is not required? Let's carefully go through the answer options together. Option A. A persistent dry cough might occur as a result of taking this medication. Option B. I might notice an increase in the frequency of my urination while on this drug. Option C. I will avoid consuming grapefruit juice while taking this medication to prevent any adverse interactions. Option D. I will try to eat more potassium-rich foods like bananas and spinach while taking this medication. Now let's determine which statement demonstrates appropriate understanding of diltiazem safety. The correct answer is option C. I will avoid consuming grapefruit juice while taking this medication to prevent any adverse interactions. Grapefruit juice inhibits cytochrome P4 503 A4 enzymes that metabolize diltiazem, leading to increased drug levels and risk of adverse cardiovascular effects such as bradycardia or hypotension. The other responses reflect misunderstandings. Option A describes a side effect commonly seen with angiotensin-converting enzyme inhibitors, not calcium channel blockers. Option B incorrectly associates diltiazem with diuretic-induced urinary frequency. And option D unnecessarily suggests potassium supplementation, which is not indicated with diltiazem therapy. Let's keep going. Question 37 is coming next, offering more insight into safe cardiovascular pharmacology practices. A nurse is administering dobutamine via continuous infusion to a client with heart failure following a percutaneous cardiac intervention. Which of the following findings would indicate that the medication is achieving its primary therapeutic objective? Let's carefully go through the answer options together. Option A. Enhanced sinoatrial node stimulation, resulting in a faster heart rate. Option B. Increased systemic vascular resistance, contributing to vasoconstriction. Option C. Augmented stroke volume and perfusion, consistent with improved cardiac output. Option D. Elevation in systolic blood pressure beyond baseline values. Now let's determine which response best reflects the intended therapeutic effect of dobutamine. The correct answer is Option C. Augmented stroke volume and perfusion consistent with improved cardiac output. Dobutamine is a synthetic catecholamine that primarily stimulates beta-1 adrenergic receptors, increasing myocardial contractility and stroke volume. This enhances overall cardiac output, which is critical in improving tissue perfusion in heart failure patients. The other options do not represent the drug's primary goal. Option A, while dobutamine may cause increased heart rate, this effect is secondary and potentially harmful if excessive. Option B is incorrect, because dobutamine may cause mild vasodilation rather than vasoconstriction. And option D, an elevated systolic blood pressure, is not a targeted endpoint and can increase cardiac workload unnecessarily. Keep your clinical reasoning sharp. Question 38 is coming up next to further expand your understanding of cardiovascular pharmacology. The nurse is caring for a hospitalized client with a documented exacerbation of chronic systolic heart failure. On assessment, the client exhibits worsening dyspnea on exertion, babasilar crackles, jugular venous distension, and 3+ pitting edema in the lower extremities. The client is oliguric and has gained 3.2 kilograms, or 7 pounds, over the past 48 hours. Based on this clinical picture, which of the following medications should the nurse anticipate administering to address the client's current status? Let's carefully go through the answer options together. Option A, mannitol. Option B, furosemide. Option C, diltiazem. Option D, verapamil. Now let's determine which medication best aligns with the client's presentation of acute volume overload. The correct answer is option B, furosemide. Furosemide is a potent loop diuretic that promotes the excretion of sodium and water by inhibiting their reabsorption in the thick ascending limb of the loop of Henle. This action helps relieve pulmonary and peripheral congestion, improves urine output, and reduces preload, making it the appropriate intervention in acute decompensated systolic heart failure. The other options are inappropriate. Option A, mannitol, is an osmotic diuretic used for intracranial pressure and is contraindicated in heart failure due to the risk of fluid overload. Option C and Option D, diltiazem and verapamil, are non-dihydropyridine calcium channel blockers with negative inotropic effects, which can worsen systolic dysfunction and are contraindicated in heart failure with reduced ejection fraction. Let's continue. Question 39 is coming up next as we build further on acute care pharmacologic interventions. The nurse is evaluating a client's understanding of transdermal clonidine therapy prescribed for chronic hypertension. During a follow-up visit, the client verbalizes their knowledge regarding patch use and safety precautions. Which of the following client statements would prompt the nurse to initiate additional education? Let's carefully go through the answer options together. Option A, I don't need to take it off if I take a shower or bath. Option B, I should remove and replace the patch after wearing it for 5 days. Option C, I might feel sleepy while on this medication. Option D, if I need an MRI, I will take off the patch beforehand. Now let's determine which statement indicates a misunderstanding of proper clonidine patch use. The correct answer is option B. I should remove and replace the patch after wearing it for 5 days. This is incorrect because the clonidine transdermal patch is designed for 7-day use. Changing it after 5 days could result in inconsistent medication levels and reduced blood pressure control. The other statements are appropriate. Option A is correct because the patch is waterproof and can remain on during bathing. Option C reflects awareness of clonidine's sedative effects. And Option D correctly notes that the patch should be removed before magnetic resonance imaging due to potential heating from metallic components. Let's move on. Question 40 is next, taking you deeper into advanced medication safety and patient education. The nurse is assessing a 3-year-old child with a diagnosis of congestive heart failure who is currently receiving digoxin therapy. Based on the pharmacodynamics and age-related considerations of this cardiac glycoside, which of the following clinical manifestations would most likely represent an early indicator of digoxin toxicity in this pediatric client? Let's carefully go through the answer options together. Option A, reports of lightheadedness during activity. Option B, development of an elevated resting heart rate. Option C, onset of recurrent emesis without another identifiable cause. Option D, evidence of poor weight gain over the past several weeks. Now let's determine which finding most accurately reflects an early sign of digoxin toxicity in a child. The correct answer is Option C, onset of recurrent emesis without another identifiable cause. Vomiting is one of the most common and earliest observable signs of digoxin toxicity in pediatric patients, especially because young children may be unable to describe other symptoms such as visual disturbances or dizziness. The other options are less specific. Option A, lightheadedness, is more difficult for a 3-year-old to articulate and typically appears later. Option B, an elevated resting heart rate, is not consistent with digoxin's effect, as the drug tends to slow heart rate. And option D, poor weight gain, is a chronic sign of heart failure, but not an acute sign of drug toxicity. Let's continue. Question 41 is coming up next with more pediatric pharmacology insight. The nurse educator is delivering an in-service on evidence-based pharmacologic therapies for hypertension and heart failure. During the discussion on angiotensin receptor blockers, such as valsartan, which of the following pharmacologic mechanisms should be accurately emphasized to enhance staff understanding of its therapeutic action? Let's carefully go through the answer options together. Option A. Valsartan inhibits the enzymatic conversion of angiotensin 1 to angiotensin 2. Option B. Valsartan selectively inhibits the binding of angiotensin 2 to its receptors. Option C. Valsartan exerts central alpha-2 adrenergic stimulation to suppress sympathetic outflow. Option D. Valsartan impedes beta-adrenergic receptor activation at both beta-1 and beta-2 sites. Now, let's determine which statement correctly explains valsartan's mechanism of action. The correct answer is option B. Valsartan selectively inhibits the binding of angiotensin 2 to its receptors. Valsartan is classified as an angiotensin receptor blocker, or ARB, and it works by blocking angiotensin 2 from binding to its type 1 receptors located in vascular smooth muscle and the adrenal glands. This action promotes vasodilation, reduces aldosterone-mediated sodium and water retention, and lowers blood pressure, making it effective for both hypertension and heart failure. The other responses describe mechanisms of different drug classes. Option A describes the action of angiotensin-converting enzyme inhibitors. Option C reflects the mechanism of clonidine, a centrally acting alpha-2 agonist. And option D is the pharmacologic profile of beta blockers. Let's continue. Question 42 is up next, as we expand our knowledge on cardiovascular pharmacology. Here's another example of a common NCLEX test question focused on medication monitoring and client safety. Want a one-stop NCLEX solution? Our complete NCLEX review online course gives you 100 hours of animated lessons, 500 hours of instructor-led videos, 5,000 practice questions, and NGN-style case practice. You'll also get 15 CAT simulation exams to mimic the real test, and a comprehensive ebook that goes wherever you go. Enjoy 1 full year of access without worrying about renewals. Hold tight. I've got something that will boost your prep game. Check out the description, click the link, and enroll today. Let's continue and move on to another essential clinical pharmacology question, question 43. A nurse is evaluating a client's clinical response after initiating therapy with amlodipine for the management of stage 1 essential hypertension. Which of the following assessment findings would best indicate that the medication is achieving its intended therapeutic effect? Let's carefully go through the answer options together. Option A, hemoglobin, A1C of 5.6%. Option B, blood pressure reading of 119 over 79 millimeters of mercury. Option C, capillary blood glucose level of 88 milligrams per deciliter. Option D, total cholesterol level of 190 milligrams per deciliter. Now let's determine which of these values most directly reflects the effectiveness of amlodipine in treating hypertension. The correct answer is option B, blood pressure, reading of 119 over 79 millimeters of mercury. Amlodipine is a dihydropyridine calcium channel blocker that lowers blood pressure by causing peripheral arterial vasodilation. A reading within the normal range confirms that the medication is working as intended. The other values reflect positive health markers, but are not related to amlodipine's mechanism of action. Option A measures long-term blood glucose control. Option C reflects current blood glucose, and option D indicates lipid status. All are important, but not indicators of antihypertensive effect. Let's move on. Question 43 continues our focus on evaluating therapeutic outcomes in clinical pharmacology. The nurse is managing the care of a client with unstable angina who is receiving continuous intravenous nitroglycerin infusion. Which of the following clinical parameters is the most essential for the nurse to monitor frequently to ensure safe and effective medication administration? Let's review the options. Option A, heart tones. Option B, respiratory rate. Option C, urine output. Option D, blood pressure. Now let's discuss which parameter requires the most frequent monitoring during intravenous nitroglycerin therapy. The correct answer is option D, blood pressure. Nitroglycerin is a powerful nitrate class vasodilator that reduces both preload and afterload, making it an essential drug in managing angina and acute coronary syndromes. However, because of its potent effect on vascular tone, it can cause significant hypotension. Monitoring blood pressure closely is essential to prevent adverse outcomes such as dizziness, reflex tachycardia, syncope, or impaired organ perfusion. While heart tones, respiratory rate, and urine output are all relevant clinical markers in broader assessments, they do not directly or immediately reflect the hemodynamic changes caused by nitroglycerin. Regular blood pressure checks, every 5 to 15 minutes in some acute settings, are necessary to ensure the client's safety. Up next, let's take a look at Question 44, which dives deeper into cardiovascular pharmacology and nursing responsibilities in high-acuity scenarios. A nurse is reviewing newly prescribed medications for a hospitalized client who has developed sinus bradycardia with a heart rate of 48 beats per minute. Which of the following medication prescriptions should prompt the nurse to seek immediate clarification with the prescribing provider? Let's look at the options. Option A is propranolol. Option B is furosemide. Option C is spironolactone. And option D is valsartan. The correct answer is Option A, propranolol. Propranolol is a non-selective beta-adrenergic receptor blocker that slows the heart rate and reduces myocardial contractility. While beneficial in managing conditions like hypertension and tachyarrhythmias, it is contraindicated in clients with bradycardia. Administering propranolol to someone with an existing heart rate of 48 beats per minute could dangerously suppress the sinoatrial node further, possibly leading to symptomatic bradycardia, hypotension, or even heart block. In contrast, medications like furosemide, spironolactone, and valsartan do not directly affect heart rate and do not require immediate intervention in the context of bradycardia. This scenario underscores the importance of evaluating a client's cardiac rhythm and baseline vitals before administering rate-controlling agents. Up next, we'll continue with Question 45. Focusing on medication safety in cardiovascular nursing, a nurse is caring for a client with acute decompensated heart failure who has been prescribed intravenous bumetanide. Following administration, which of the following clinical findings would most accurately indicate a therapeutic hemodynamic response to the medication? Before we dive into the answer choices, let's walk through each option together to evaluate the most accurate therapeutic indicator. Option A, elevated right atrial pressure as reflected by increased central venous pressure. Option B, decreased ventricular filling volume and myocardial wall stress. Option C, reduction in the kidney's filtration efficiency as evidenced by a lower glomerular filtration rate. Option D, heightened resistance within the systemic arterial vasculature, increased systemic vascular resistance. Now let's determine which of these reflects a true therapeutic benefit of bumetanide administration. The correct answer is Option B, decreased ventricular filling volume and myocardial wall stress. Now, why is this the most appropriate clinical indicator? Bumetanide is a potent loop diuretic that rapidly removes excess fluid by acting on the thick ascending limb of the loop of Henle to block sodium and chloride reabsorption. In heart failure, this helps reduce circulating volume and venous return, meaning less volume in the heart during diastole. As a result, we see a reduction in preload and myocardial wall tension, which helps alleviate pulmonary congestion and improve overall cardiac efficiency. So when evaluating therapeutic outcomes, look for signs of volume relief, not elevated pressures or vascular resistance. Let's power ahead. Question number 46 is coming right up, and it's one you will not want to miss. A client newly diagnosed with a 4.8 centimeter abdominal aortic aneurysm is being evaluated by the interprofessional team. The nurse should anticipate a pharmacologic intervention aimed at minimizing aneurysmal expansion and reducing hemodynamic stress on the aortic wall. Which of the following prescribed medications aligns with the therapeutic objectives in managing this condition? Before we review the correct answer, let's walk through each of the options. Option A, naproxen. Option B, digoxin. Option C, prednisone. Option D, atenolol. Now, let's explore which of these choices directly supports the therapeutic goal of reducing stress on the aortic wall. The correct answer is Option D, atenolol. Atenolol, a cardioselective beta-adrenergic blocker, is commonly prescribed in clients with abdominal aortic aneurysm to effectively reduce both heart rate and systemic arterial blood pressure, two hemodynamic parameters that directly influence aortic wall tension and shear stress. By decreasing myocardial contractility and cardiac output, beta blockers help lower the mechanical force exerted on the aneurysmal segment, thereby slowing aneurysm progression and reducing the likelihood of rupture. Beta blockers are also associated with a reduction in aneurysm growth rate in observational studies and are considered first-line pharmacologic agents when surgical intervention is not immediately indicated. Let's keep the momentum going. Question number 47 is coming your way next, and it brings another critical scenario to master. A nurse is providing discharge education to a client who has been prescribed sublingual nitroglycerin for the management of stable angina. The nurse emphasizes key points about storage, administration technique, and safety precautions associated with nitrate therapy. Which of the following client statements best reflects an accurate understanding of the medication regimen? Let's take a moment to carefully evaluate each of the answer choices before identifying the most appropriate one. Option A. I should place the tablet between my cheek and gum to let it dissolve slowly. Option B. I should store the tablets in the original dark bottle to protect them from light. Option C. I should take this medication while standing up so it works faster and prevents indigestion. Option D. I will take one tablet every 7 to 10 minutes if chest pain doesn't go away right away. Now, let's identify the correct response that aligns with best practice for nitrate therapy. The correct answer is Option B. I should store the tablets in the original dark bottle to protect them from light. Sublingual nitroglycerin is highly sensitive to light, heat, and moisture, which can significantly reduce its potency. Storing the tablets in their original amber-colored glass container with the cap tightly closed ensures chemical stability and therapeutic efficacy. Clients should also be educated to replace the bottle every 6 months, even if unused, to avoid diminished drug activity during a cardiac event. Let's tackle another valuable NCLEX exam question. Need an all-in-one NCLEX prep package? Our complete NCLEX review online course delivers 100 hours of animated content, 500 hours of expert-led videos, 5,000 practice questions, and NGN-style case scenarios. You'll also get 15 CAT mock exams to mirror the real test experience and a comprehensive ebook you can access anytime. Plus, enjoy a full year of unlimited access, no renewals required. Hang tight. Check the description, click the link, and sign up today. Now let's jump into the next practice question. Let's move forward to another important medication safety question. Question 48. A nurse is delivering a pharmacology education session for a group of graduate nurses regarding the therapeutic use and contraindications of beta-adrenergic blockers. During the session, the nurse emphasizes the importance of identifying clinical conditions in which beta blocker administration would be potentially harmful. Which of the following clinical scenarios should the nurse highlight as a clear contraindication to beta blocker therapy? Let's go through each answer choice carefully and evaluate which one represents a clear red flag. Option A. A client with chronic atrial fibrillation managed with rate control pharmacotherapy. Option B. A client hospitalized for acute ST elevation myocardial infarction with stable vital signs. Option C. A client with compensated systolic heart failure receiving guideline-directed medical therapy. Option D. A client exhibiting signs of cardiogenic shock with hypotension and markedly reduced perfusion. Let's now identify which scenario is most dangerous in the context of beta blocker therapy. The correct answer is option D. A client exhibiting signs of cardiogenic shock with hypotension and markedly reduced perfusion. Cardiogenic shock represents a state of profound pump failure, most often due to a large myocardial infarction leading to critically low cardiac output and tissue hypoperfusion. In this context, beta blockers are absolutely contraindicated due to their negative inotropic and chronotropic effects, which further suppress myocardial contractility and reduce heart rate. Administering a beta blocker during cardiogenic shock would exacerbate hypotension, worsen end organ perfusion, and could precipitate cardiovascular collapse. Ready for another high-yield clinical scenario? Let's continue now with question number 49. The nurse is reviewing pre-treatment laboratory data before initiating intravenous amiodarone for a client admitted with hemodynamically unstable ventricular tachycardia. Recognizing the potential systemic effects of this antiarrhythmic agent, which of the following laboratory values is most essential for the nurse to monitor periodically throughout therapy? Let's walk through each of the options and determine which lab value is most critical for patient safety. Option A, differential leukocyte count. Option B, fasting plasma glucose concentration. Option C, serum uric acid concentration. Option D, thyroid-stimulating hormone level. Now let's identify which of these labs must be monitored closely while the client is on amiodarone. The correct answer is option D, thyroid-stimulating hormone level. Amiodarone is a class 3 antiarrhythmic, known for its efficacy in managing life-threatening ventricular and supraventricular arrhythmias. However, it exerts complex effects on thyroid function due to its high iodine content and its inhibitory effect on the peripheral conversion of thyroxine to triiodothyronine. It may cause both hypo and hyperthyroidism. Therefore, periodic monitoring of thyroid-stimulating hormone as part of a comprehensive thyroid panel is essential to detect amiodarone-induced thyroid dysfunction. Ready to keep building your confidence with more clinical insight? Let's move into question number 50. The nurse is providing discharge education to a client newly prescribed metoprolol for the management of stage 1 essential hypertension. Which client statement demonstrates the most appropriate understanding of the pharmacologic effects and safety considerations associated with this medication? Let's take a moment to examine the options and evaluate which response best reflects accurate knowledge. Option A. If I start feeling dizzy or lightheaded, I should discontinue the metoprolol immediately and call my provider. Option B. Metoprolol helps lower my blood pressure by increasing the release of angiotensin II from the kidneys. Option C. I should routinely check my pulse because metoprolol can slow my heart rate more than expected. Option D. It's best to take metoprolol with a high-fat meal to make sure my body absorbs it properly. Now, let's identify the correct statement that aligns with the safe use of this cardioselective beta blocker. The correct answer is option C. I should routinely check my pulse because metoprolol can slow my heart rate more than expected. Metoprolol is a beta-1 adrenergic receptor blocker that decreases sympathetic stimulation to the heart, reducing both heart rate and blood pressure. Clients must be educated to monitor their heart rate regularly and report any significant bradycardia or symptoms like dizziness and fatigue. Let's keep the momentum going. Coming up next is question 51. The nurse is evaluating a client's understanding of self-administered transdermal nitroglycerin therapy prescribed for chronic stable angina. Which statement by the client demonstrates accurate comprehension of appropriate administration and safety precautions related to transdermal nitrate therapy? Let's take a closer look at each of the choices to determine which response demonstrates safe and effective use of the transdermal patch. Option A. I can apply the patch over an area I've recently shaved to ensure good skin contact. Option B. I'll remove the patch for 4 to 6 hours daily to prevent my body from becoming too used to the medication. Option C. It's safe to keep the patch on while I shower, but I'll be sure to avoid exposing it to heat sources. Option D. I should place the patch below my knee because that location might reduce my chances of getting a headache. Now let's identify which statement aligns with best practices for transdermal nitrate use. The correct answer is option C. It's safe to keep the patch on while I shower, but I'll be sure to avoid exposing it to heat sources. Transdermal nitroglycerin can be worn during normal hygiene routines, but heat exposure may increase absorption and lead to adverse effects such as hypotension. Excellent understanding of how to manage this medication safely. And that wraps up today's session on cardiovascular pharmacology. Great job sticking with me through these high-yield NCLEX questions. Remember, mastering these kinds of questions not only prepares you for the NCLEX, but also shapes you into a safe and confident nurse. If you found today's video helpful, don't forget to hit the like button, subscribe, and turn on the notification bell so you never miss an update. We have plenty more exciting topics coming your way, from pharmacology to patient care strategies and everything in between. Make sure to leave a comment below if you have any questions or topics you want us to cover next. We love hearing from you. Thanks for watching, keep up the great work, and I'll see you in the next video with another must-know NCLEX topic. Until then, happy studying and stay motivated.